Hi viewers and dear biomeds. Welcome to Biomed Explorer. Biomed Explorer is sowing the seeds of knowledge to biomedical engineers across the globe. I hope you all get benefit from the knowledge we share. Do anyone wonder what this the concept is about? History behind inventions. We gonna learn the inventions of medical devices and the history behind those inventions. Are you all bored in knowing the history? Don't worry, guys, we make it interesting for you. Let's get into the video. Today's video is about the invention of a stethoscope. Let's hear some interesting story. In France, there lived a French physician named Dr. Reine Theophile Hyacinthe Lenec. Dr. Reine is a pioneer in diagnosing various cardiac conditions. He is also a lecturer and professor in medicine. But from his professional life, he is a good musician too. Dr. Reine is good in making wooden flutes on his own. In older days, as we already know, there are least number of resources for diagnosis and for providing treatment, right? Same way, Dr. Reem used to diagnose his patients by placing his ear on the patient's chest. He used to hear the heart sounds of the patients to find out whether their condition is normal or typical. One day, a pregnant lady came to his clinic with a cardiac ailment. To diagnose her condition, Dr. Reen was about to place his ear on the patient's chest. But Dr. Reen was a bit embarrassed in doing so. He was confused and thinking for an alternative method. Suddenly, he got an idea. He remembered seeing two children were playing with hollow sticks by producing a scratching sound on it. One child was scratching the one end of the stick. The another one was hearing the amplified sound from the other end of the stick. So, can you guys guess what he did with this idea? Dr. Reen took a paper, rolled it, and placed it on the patient's chest. He wondered that he could hear the heart sounds clearly from the rolled paper better than his own ear. This made him to develop a stethoscope, or this led to the invention of a stethoscope. He invented the stethoscope, which looks exactly like a hollow wooden tube. Dr. Rein Lennox's stethoscope was invented in the year 1816. He named his invention as stethoscope, and the name stethoscope was derived from two Greek words, stethos meaning chest and scope in meaning to view or see. He called this method of diagnosis as auscultation. Auscultation means to listen. After 25 years of usage, another physician, Dr. George Philip Kamen from New York, made some changes to Dr. Ween's stethoscope. George developed a binaural stethoscope with two earpieces. This was the first stethoscope with an earpiece. Dr. George's stethoscope was used for more than 100 years by the physicians. And in those times, modifications were made to the stethoscope by other doctors. In the early 1960s, Dr. David Littman, a famous cardiologist and recognized personnel of the electrocardiography department, developed a new stethoscope that came into use all over the world. This is because of the improvements in its acoustical performance. Dr. Littman's stethoscope is then considered as a powerful diagnostic tool in the auscultation procedure. All other recent advancements are made from the base of Dr. Littman's stethoscope. Here you have a short video where you can see the advancements that are made to the stethoscope with the help of biomedical technology. Acoustic stethoscope. This is an electronic stethoscope. Fetal stethoscope, which we call it as stethoscope. Pediatric stethoscope. Teaching stethoscope. And finally, smart stethoscope that use IoT and Bluetooth technology. Hope you all enjoyed watching the video. Please subscribe to our YouTube channel to receive regular updates and share your feedback in the comments. To know about the stethoscope, its types in detail, kindly follow Biomed Explorer Instagram page. You can learn new concepts and participate in daily quizzes posted in our Instagram story. You can also follow us in LinkedIn and Facebook. Please like our video and share it with your friends. Stay positive and stay tuned. Thank you so much.